Welcome back to Patch. I'm Chris,
I'm Sawyer.
and today we're going to be talking about preventing drug misuse and addiction, the best strategy. Why is adolescence a critical time for preventing drug addiction? Adolescence is a critical time because at that point the brain is still developing up until the age of 25. Once the brain hits 25, it is fully done developing, but you still shouldn't use drugs even past 25. But especially before 25, you should not be using it because it will affect you a lot more than a person that is done fully developing in the head. As noted, earlier use of drug use increases a person's chance of becoming addicted. Remembering the drug changes the brain, and this can lead to addiction and other serious problems. So preventing drug use and alcohol use early is a key point and way of reducing these risks. The risks of them also increase during the grade of transition. For an adult, a divorce or a loss of job may increase the risk of drug use. For a teenager, risky times include moving, family divorce, or changing of schools. When children advance from elementary through middle school, they face new and challenging social, family, and academic situations. Often during this period, children are exposed to substances such as vaping, nicotine, and other substances, as well as notice a greater availability of it by the older teens, and social activities where drugs are used. When individuals leave high school and live more independently, either college or as employment as an adult, they may be exposed to drug use while separated from the protective structures provided by family and school. A certain amount of risk taking is a normal part of life and adolescent development. The desire to try new things becomes more and more independent as they become more and more independent is healthy. But they may also increase teen tendencies to experience with drugs. The parts of the brain that control judgment and decision making do not fully develop until people are in their early to mid 20s. This limits a teen's ability to accurately assess the risks of drug experimentation and making young people more vulnerable to peer pressure. Can research-based programs prevent drug addiction and use? Yes. The term research-based or evidence-based means that these programs have been designed based on current scientific evidence, thoroughly tested, and shown to produce positive results. Scientists have developed a broad range of programs that positively alter the balance between risk and protective factors for drug use in families, schools, and communities. These studies have shown the results based on programs such as described in NIDA's Principles of Substance Abuse Prevention for Early Childhood, and it can significantly reduce early use of tobacco, alcohol, and other drugs. Also, while many social and cultural factors affect drug use trends, when young people perceive a drug use as harmful, they often reduce the level of use.
Now, you may ask yourself the question, how do research-based prevention programs work? These prevention programs work to boost productive factors and eliminate or reduce risk factors for drug use. The programs are designed for various ages and can be used in individual or group settings. Such as the school and home, there are three types of programs. Universal programs, which address risk and protective factors common to all children in a given setting, such as a school or community. Selective programs are for groups of children and teens who have specific factors that put them at increased risk of drug use. Indicated programs are designed for youth who have already started using drugs. Young brains under study. Using cutting-edge image technology, scientists from the NIDA's Adolescent Brain Cognitive Development Study will look at how childhood experiences, including any use of drugs, interact with each other and with a child's changing biology to affect brain development and social, behavioral, academic health, and other outcomes. As the only study of its kind, the ABCD study will yield critical insights into the foundational aspects of adolescence that shape a person's future.
That is all on preventing the drug misuse and addiction. Have a wonderful day.